I am completely honored to introduce our next guest. Dr. Sid Baker is a pioneer in our field when it comes to biomedical and autism, and it's such an honor to have you here today. Thank you for being here.
Thank you for inviting me.
So we want to talk today about, a lot of people might not know, or if they're new to autism, Defeat Autism Now. Can you talk to me about how you got started in this and how you became one of the pioneers with Bernie Rimland?
Well, I guess it began in terms of the specific autism thing before I even met Bernie or became close friends with him, was when I had seen a child on the request of a neighbor of the child, the neighbor being a former patient of mine when I worked in the prepaid health plan in New Haven and then moved as director of the Gazelle Institute. So she wasn't my patient anymore, but she referred her neighbor who had a child with horrible eczema. And my former patient knew right away that a trial of a kind of antifungal like Saccharomyces boulardii would be a cool thing to do. And so, or nystatin, I think that was what the choice was. But so she sent her neighbor over to have a 5-minute conversation for me, sort of a freebie, just so I would write a prescription for some nystatin, which is a completely harmless medication. And a few weeks later, I learned that the child's horrible eczema had completely gone away. So did her autism. And I didn't even know that the child in question was autistic because I didn't examine the child. This was just a sort of a short-term favor. Well, that caught my attention. In those days, of course, autism was seen previously as something way out there in the diagram of illnesses. It was kind of out in the stars and the sky, instead of being in the core of where the real diseases are. And as you know, it had been blamed on cold mothers for a generation or more, and only with the publication of Bernie Rimland's book did people realize that that was nonsense, and in fact it was a biological problem. But the fact that it responded to an antifungal medicine in this child impressed me, because I knew a lot about antifungal medicines and was enthusiastic of the idea that you should probably try them no matter what's wrong with you, because it's has to do with the germs in the gut that get out of whack in people who live the way we do, with eating a lot of sugar and antibiotics. So the idea that autism came in that way was an important turning point for me. Now, I had been prepared for that to some extent because I had been working as a consultant in an institution for seriously disabled people, and one of my jobs was to have an annual physical exam, and I had a young man who was severely handicapped, although he was a very handsome, normal-looking kid, a teenager. And I went to examine him. Now, I, at that point in my life, never met an autistic person.
And what year was this?
This was 1972, I think.
Okay.
And so I made the mistake of just doing a routine physical exam, which under some circumstances you just sort of start at the top and go to the bottom, and it's kind of a routine. But here's this boy sitting on the end of an exam table who is nonverbal. And again, I was new to that sort of experience of nonverbality, if you want to call it that. And so I went to look in his eye with my otoscope as an early part of the exam. And he hauled off and whacked me as hard as he could. He got me right between the eyes, and he shattered the bridge of my eyeglasses, which went in 2 pieces onto the floor. And I thought to myself, wow, that was really remarkable precision. and then I backed off and we started again and got through the whole thing. But on reflection, not too long after, I thought, he was saying something to me with his fist, which is, you're looking into me, but you're not seeing me. And I thought that represented a remarkable intelligence for him to sort of think that way or react that way. So my previous training about autism was, well, you're never going to see an autistic person because it's so rare. You know, that was the way we were taught in the 1960s and 70s. And yet now I had a taste of something that made me think in a way that was, you might say, sympathetic, that it gave me a feeling in my heart that this is something I should handle differently in terms of my behavior as a doctor, but also in my imagination, like what is going on here. So that was a kind of turning point for me. But then, as I became more and more acquainted with autism, I had the opportunity, after I left the faculty of Yale Medical School, full-time, I was a full-time assistant professor of medical computer sciences and pediatrics and obstetrics and so on. And so then at a certain point I decided maybe I want to go be a real doctor. And I kept my academic appointment as part-time, but then I went as a full-time practitioner in a prepaid health plan. I had a chance then to mature a little bit, hearing patients' stories that gave me a new line on how things work with my patients. I mean, it basically gave me the beginning of a paradigm, which is if you're dealing with somebody who is chronically ill, you should consider whether there's something for which they have an unmet need to get, avoid, or be rid of, that if it was taken care of would nurture healing. So I was in the beginning of that process. Well, Bernie Rimland came to the Yale Child Studies Center, which had been part of my home, sort of, to give a talk. And so I went over to the place and sat in the audience, and I was here and Bernie was there, and he gave his talk. And Yale was the last place in the world that would welcome Bernie. The people who lived there were the people who really believed in the cold mother theory. They were still alive and had not changed their mind. And here was this guy from California, and also he was a psychologist, worked for the Navy. He had an autistic child, but he had written this book that, of course, changed everything, but it didn't change Yale. It didn't change the people in that room. And so after he just gave his talk about the things that we now know to be important, there was this very, very condescending clapping of the hands, but a very insulting approach to Bernie. And he was used to this. He was going around the world lecturing, and he was used to being treated poorly, but not usually as poorly as he was at Yale. But I stood up then, and as it happened, I had a fairly good reputation at Yale. I had been a medical student there. I'd won all the prizes. I had been chief resident and so on. And I stood up and I said, well, I think you should know that since I've been out in practice and thought about these things and so on, I agree with everything that Bernie said, and it's something we have to pay close attention to because this is the way it's going to turn out, just in terms of the logic and the common sense of what he said. Well, Bernie and I became friends in that moment, and from then on, over the years, we stayed in touch, and then as he was in his traveling, he traveled a lot, and he would stop by in Connecticut and see me, and we'd have lunch, and during lunch I'd say, Bernie, and on one occasion I said, Bernie, this was now up in the 1980s or early 90s, and I said, Bernie, I'm overwhelmed, number one, by the prevalence of autism, and number two, by the strong evidence that the biochemistry, immunology, toxicology is something that I really need to know more about in order to handle these kids. And I said, Bernie, you know all these smart people around the world that you interviewed when you wrote your book. Couldn't we get some people together and have a sort of a meeting? And so he had resources from his institute. I had resources from a wealthy parent of my patient, and we proposed to put on a meeting and bring people together who would be sympathetic to letting the data talk, is one way of putting it, but also finding common ground. So when we met in Texas in the early 1990s, a meeting of about 30 people who were parents, practitioners who were parents also of sometimes some of them of autistic children, and scientists, all in one room. It was an unusual attendance. Usually people split up to just be with their own species. And here was 3 different species together. And I went at the beginning of the meeting, I said, my friends, we are here to find common ground. We have differences, but let's find what we agree on. And I had a piece of chalk and a blackboard, and we started to go through and make sort of a diagram of how we felt this all fit together. We met for breakfast, lunch, dinner, morning, afternoon, evening. We did everything but sleep together. And we just had a fabulous time. Everybody except 2 people in the room agreed that this was the best meeting they'd ever been to. And we did find common ground. And my diagram formed a picture of how the interrelationship of these various factors about certain things maybe children with autism may need to get in order to help stabilize their chemistry, or avoid because they're sensitive in certain ways, or get rid of because of toxic questions that might have to do with their disorder. And then I wrote with John Pangborn, who was a dear friend of mine, a biochemist, so he did the biochemistry, I did the clinical side, and we published a little pamphlet, and then it grew into a booklet, and then it grew into a book, and then it grew into more books. And that was really the beginning of my chance to use the wonderful contacts that Bernie had developed to help form a group of people who wanted to work together on this. And that group remained alive in many ways. We thought this was such a cool meeting, well, let's do it again next year, and how could we afford it? And I said, well, why don't we charge admission? And people could come and hear us talk. And it remained a system of meetings that went on being a chance for clinicians, scientists, and parents to get together. That was a wonderful thing, and unfortunately some of the meetings we have now exclude parents for reasons that are difficult to talk about, because it's because some of the people who are suppliers of various substances that people buy when they have autistic problems feel that it's not appropriate for the parents to be around when they're talking about selling stuff. But up until recently, we did have this forum in which these 3 kinds of experts were all together, and we had to certainly respect and love the expertise of parents. And naturally, I think, as you know, I was firmly convinced that what we were doing as clinicians and as parents and as scientists was all about love. It was all about trying to find in our hearts the connections that were naturally connected to our brains that would help us answer these questions about children in general, that began with the simple question is, does this child, not the diagnosis, but does the child, does the individual child have a special unmet need which, if provided for, would help favor nature's buoyant impulse toward healing? Or does the child have a need to avoid something that would do the same thing, that would nurture nature's buoyant impulse toward healing? Or maybe the child has to get rid of something, such as lead, mercury, and that kind of thing. So that's where it all grew, but it grew in connection with this friendship with this extraordinary person who had really, he worked for the Navy and as a psychologist, and so when he went around the world interviewing people, he was a nobody. And when he published his book, he was a nobody. And when he came to Yale, having published the book, he was still a nobody to the people at Yale. But if one simply opened one's heart and one's mind, you could see he was a genius. But he didn't act like a genius. He didn't talk like a genius. He just talked straight of what he knew to be the case after discussing autism with various experts from around the world, most of them starting from a point that was very distant in the past, when we arrived at the point in the future where we understood autism from the perspective that I just described.
And that's how Defeat Autism Now came about, was because
that's right.
Of you and people like, and Bernie Rimland, who basically, I always think of him as one of the grandfathers of Biomedical.
Well, he is, yes.
Yeah.
And the name Defeat Autism Now is his name, with an exclamation point after it. None of us liked the name, but we loved Bernie. So, he wanted that name, he got it. But the idea, of course, defeating autism makes autism sound like a thing. And one of the things that we have to consider is how our language may lead us in the wrong direction. And autism is an idea we form about different people who have certain similarities, but it is not a thing. And in our medical culture, the lingo is so much built around, this is the disease, and this is the disease treatment that has to be a pill, and that's why we do it. And that's what you see on TV all the time now, is all these medicines that suppress your immune system and relieve symptoms for people who share a common kind of disease name. But that is completely contrary to a reality in which the individual is the target of treatment, and individuality has to be respected by getting the details, the symptoms that tell exactly what's going on in the person's body, along with lab tests, and then trying to balance that rather than just, what's the treatment for autism, which is just crazy. But of course you read all these things you get all these things on TV, or what's the treatment for arthritis or whatever, and it's always some kind of pill that suppresses your immune system or similar things, which is just an indication that our culture has gotten off on the wrong bus stop.
Well, and I'm a parent of a child with autism, and I've met hundreds, if not thousands, of children in the decade that I've been meeting families due to my son, and I never really see two, like if I meet one child with autism, I met one child, because there's no two alike. They might have similarities of, maybe a stim or this, or maybe they have a gut issue or whatever, but just because you do one with one does not mean you do that with that child and it will be good for another person. So it's, treating the individual, as you said, is so important.
Exactly.
And now let's fast forward with M.A.P.S. So without Bernie Rimland and you, way back in the day, making sure to pay attention to families and listen and do what you did, there'd be no M.A.P.S. So can we talk a little bit how that crossover is happening now with M.A.P.S?
Yeah, the story is quite simple. Bernie was a person with a big heart and was comfortable with things being a little bit shaky in terms of sort of legal stuff and responsibility that doctors have for staying out of trouble. And so then Bernie died. And then Steve Edelson took over, a wonderful guy, a dedicated person in this whole thing, very interested in data, as I was, so we shared a strong interest in letting the data talk. Because Bernie, when he had been in touch with parents, when he wrote his book, then he started getting mail from parents, not email at the time, but mail. And then that meant that he could then write to the parents and say, well, tell me if you found anything that helped your child. So he built a database full of very, very important data. It remains very important, of what worked for different kinds of children that helped form a basis for research. Well, but then when Bernie died, Steve asked John Pangborn and me to come on the board of directors. And I said, oh, well, sure, I'd come on the board of directors. Of course, but just in honor of Bernie, my dear friend. John said, well, could I see your liability policy that would give protection to the board members? And it turned out that there really wasn't such a thing that would, I say jokingly that Bernie had bought something for $29.99 from Sears and Roebuck or something, because the policy was not sufficient to protect physicians who are much more dangerous than psychologists when it comes to malpractice and all that. So that meant that Steve had to retreat from putting on these conferences with all these doctors there, with all of these strange treatments that we are involved in that are new because they're focusing on nutrition and toxicology and all that. And so we were suddenly without an organization. And thanks to some people that we now know who are still involved in the M.A.P.S meeting, we came to an agreement that we should have a new meeting, a place, and a new congregation, so to speak, of physicians that were then styled in terms of liability and all that around the responsibility that all of us physicians take every day. We eat liability for breakfast, okay? But psychologists have a different attitude in terms of, whatever danger may be associated with what they do. So it was a loving transition, and then that gave rise to a series of meetings which are now in place, thanks to the support, I must say, of the four original supporters of the M.A.P.S movement, and then it became more the responsibility of the people who are now on the board and who support it financially through the generosity of Samir, and his dedication to this cause has made all the difference. He has been so supportive of us as a person who has he has a commercial interest in it, but I have never in my experience raising money for not-for-profit when I was director of the Gazelle Institute and dealing with people with money and all those kinds of things, I never met anybody with the generosity that Samir has to contribute to this new beginning of what was once the Autism Research Institute's enterprise, but now is under the M.A.P.S thing. And even to the point of when the hurricane occurred in Florida a few years ago, and a huge amount of money was lost because the hurricane canceled a meeting when it was going to be attended by 200 people and already paid their dues, but it didn't happen. And so this, even with that, the so to speak investor in this, but investor is not the right word. This was one would have to find a word that involves love and dedication and generosity, and that those words, I think, can be attributed to many of us, physicians and other medical people who are involved in the autism epidemic, but Samir gets the credit for the very sweet leadership he's given, where he doesn't try to. He's not trying to make money off of this. On the contrary, he has been extraordinarily generous, and so we owe a lot to him. It's a remarkable story. I have been in and out of not-for-profit things most of my life, in terms of my beginnings at a prepaid health plan in New Haven, where it was not-for-profit, and my directorship of the Casale Institute, which was a private not-for-profit foundation, and so on. But I've met many generous and lovely people who are connected with those things, but nobody quite like Samir. He's one of a kind, and we are blessed by his capacity to keep alive something that came out of the heart and soul of Bernie Rimland, and it's really a very sweet piece of history that is currently still evolving.
Well, I just thank you so much, Dr. Baker, for that beautiful story, and just for sharing that with so many that might not have heard it before and may not understand where Biomedical even came from and where we are today. I thank you for your dedication and your love. What message do you want to leave for the families right now that are watching that may feel a little bit lost?
Well, I think if families are feeling lost because they are uncertain about the path they should take to find a way out of this so-called spectrum, they should consider the following. The word spectrum came into our vocabulary at a time when it was important for people to understand that enormous variety is expressed in the ways that people who are injured, the children who are injured in this way, are so various and so different, so that you can't peg it down into a little tiny thing called a diagnostic label. But that put parents in an awkward position, because they go to a doctor and all these tests are done, and then the doctor says, well, your kid is in the spectrum. That's not reassuring, especially to fathers. Now, you mean to tell me that you've done all these tests and all you can tell us he's somewhere in the spectrum? We want to know what's wrong. So now what we have in the movement that's moving forward is a place where parents can find, with a little bit of effort in reading about what we do, to make decisions about the options for their child. Now, unfortunately, the parents are not coming to our meetings, and I'm very disappointed that that's the case at the moment. But there is quite a bit of good literature about autism now, and I think children should dive into it. I mean, parents should dive into it. Now, the shocking news is that some large percentage there's a large percentage of patients, of families, large percentage of parents who have never tried to do anything about autism, and from their kid, because their doctor said, oh, autism, we don't know, we have to wait to find out what the cause is and what is the treatment, because the parents are scared away by the, I would say, cynicism, if not dishonesty, of doctors who don't really know much about it. So the rule in medicine is, if you're not up on it, you're down on it. And this applies not only to the choice of a particular pill, that if you don't know much about it, you say, oh, I don't use that treatment. But when it comes to a whole spectrum of problems afflicting our children and representing to us that our culture is in deep trouble with something that is basically the result of toxic environment. I mean, if you want to come down to what's really wrong here, is that our children are being poisoned by lead, mercury, and 5,000 different chemicals and all sorts of things that have poisoned our children, and this poisoning is expressed in many different ways, and it's also expressed in asthma and all kinds of other illnesses. But that broad look at it is not something that many doctors can quite understand, because now they're being trained, and that there are these numbers of diseases, these numbers of pharmaceuticals, you match them up, you write the prescriptions, and that's the kind of thinking. And they're not equipped to deal with the spectrum. And as I say, if they're not up on it, that's down on it. So the parent says, well, you know, I want to go see one of these doctors who's in the M.A.P.S thing. Oh, don't do that. They're a bunch of quacks. Doctors are extremely protective of the dignity of their profession, if you can call it that. And they're afraid that people who have different ideas are going to ruin the game for them. But as you can tell from my tone, I am very troubled that this should be so. And I think it's only human nature that if you're not up on something, you're down on it. But I think that in the current situation where there's a real epidemic on, that people who profess medicine should be able to get on board.
Absolutely. And you know what? I am just so grateful for doctors like you, Dr. Baker. We are so grateful and honored again that you are here and not giving up on our children. So thank you again for being with us today.
My pleasure. Thank you.
And for everybody watching, thank you guys. Until next time. Bye.